proud of our college and our programs, especially our students and our faculty. We have a wonderful faculty. They are very devoted. They are very caring, and their goal really is so that our students do well. So we do have a great faculty. I don't know if any of you have met them or not, perhaps if you came to some of our open houses, but they really go out of their way for our students. We managed to get through this pandemic the last couple of years. Some of you whose students are current juniors and sophomores probably remember that when the state shut down, the university was closed as well. But knowing the importance of getting our students not only back in the classroom and in the labs, but back in the clinical environments, the College of Nursing immediately wrote a letter to the Office of the Secretary of Higher Education requesting that we allow our students to come back on campus for their simulation experiences, for their lab experiences, and to get them back into clinical. And so we were able to do that starting in May of 2020. And this year in the fall of 2021, we have been completely back on campus. And quite honestly, we were so proud of our graduates that year, the year that the state shut down in 2020, because they all graduated on time. And they had a 95% licensing pass rate. So we know that they received the education that they needed. And likewise, our 2021 students also had first-time licensing pass rate in the mid-90s. So we know that it was kind of frightening to go completely online, especially with our didactic courses, but we managed to get through it, and now hopefully we're more or less back to where we were pre-pandemic. So we're very happy about that. A couple of things I thought I would just explain. When Sandro so graciously gave that introduction, he spoke about 3 programs that we have in the college. One is a dedicated education unit. And a dedicated education unit is a unit within a clinical agency, specifically within a hospital, that is dedicated to educating young nurses. And so early on in my deanship, probably back in 2017, we reached out to a couple of hospital agencies, to Hackensack Meridian, to Englewood Hospital, and to Atlantic Health and St. Peter's. And we asked them if they would be willing to partner with us in forming these dedicated education units. And what we did was we trained the nurses, specific nurses who were interested in working with students on the units in some aspects of education and teaching. And then we brought our clinical students there. Their clinical faculty member was with them and still responsible for all of their assessment and grading. But the students partnered with the nurses on the floor, and they worked together side by side, caring for patients. And this was just such a phenomenal experience for our students, and likewise for the nurses. The nurses enjoyed it. And it's a lot of work for a nurse to precept a student while they're still working. So they did have lesser patient load, and we have continued these experiences with these hospitals and are hoping to expand more of them now that things have settled down because of the pandemic. So those are wonderful clinical experiences for our students. The other thing that we do is we have something called an honors experience. So especially for parents who have juniors, This year, what this is is an experience in their last semester of clinical, their senior year. That clinical is called a synthesis clinical. And what that means is that the students are putting everything they learned throughout these past 4 years together so that they can graduate and function as professional nurses on a unit. So we have one, our original one was actually in the pediatric intensive care unit at Morristown Medical Center. We happen to have a nurse who worked in that unit at Morristown who was one of our alum. And she actually said, because the intensive care units, the emergency departments, and those types of units are difficult to find nurses, they usually want experienced nurses in those clinical areas. And it was getting more and more difficult to find nurses who had the experience necessary to work there. So she asked us to work with her. And we had 2 students who she was their preceptor for. They worked in the pediatric intensive care unit with her. They worked, and another nurse as well. And they worked that nurse's shift. So whenever the nurse was on the unit, the student was on the unit. It was one-on-one. And again, it was a phenomenal experience. So we expanded those experiences not only to the pediatric intensive care unit, but we have them in oncology, one at Memorial Sloan Kettering, another at Hackensack Meridian Health. We have them in the pediatric unit, and we have them in some emergency departments. There's only, because there's about 6 of these experiences, or maybe we're up to 8 now, that we offer. These are offered for very high performing students, and they have to have an interest in that area where they're doing this honors immersion experience. And every one of our students, when they have graduated, they have all been offered positions in that hospital. So it's actually wonderful because it's like a 4-month interview, more or less, where the unit and the nurses are observing the student, and likewise the student is getting an experience where they know that this might be the area or the institution in which they would like to work. So those are some wonderful, wonderful experiences that we're able to offer our students. We also have something called the Bacino Leadership Institute. Some of your students may be a member of that. The Bacino Leadership Institute is a leadership program that was started in the Stillman School of Business, and it was funded by Mr. Bacino, who has donated to this program. And it's a very intensive leadership institute. So students apply to this program as freshmen, or even when they apply for admission, and they're accepted. So let me think, 4 years ago, actually, because we're graduating our first class now. 4 years ago, our then provost, Dr. Karen Boroff, had the vision to expand this program to go outside of business. So she expanded it to the other schools in the university. So nursing, communication and the arts, education, arts and sciences. And we have, so within that institute are students from all of those schools, and each school has their own associate director. Our associate director happens to be one of our faculty members, Dr. Kathleen Connolly. They meet on Fridays. They meet every Friday. They have leadership experiences. They learn about topics in leadership. They do projects within their schools. We had, at the time of the pandemic, after the first year of the pandemic, a couple of the leadership students put together a program for our alumni. So as you know, because of the pandemic, nurses working on the front line, it literally was a war zone. Nurses have never in this generation faced anything like this before. And so they decided that they wanted to do something and give back to our alum. So we had a dinner, a reception for our alumni who were frontline workers. It was beautiful. We had over almost 150 people there, and it was a dinner, and one of our students created a beautiful video where she had interviewed many of the nurses at work in the hospitals. And we had two guest speakers, nurses, who talked about their experience working during the pandemic. Both happened to have been working in intensive care units. And it was truly a wonderful experience. And this was just, it was an idea that the students, the leadership students, thought of on their own, and Dr. Connolly and the College of Nursing just supported them to make sure it would happen. So it really is a wonderful experience. So I would encourage you to encourage your students. Sometimes if a student drops out of a program, there might be an opening. So I would just encourage your students to be aware of that, and if there is an opening, to possibly see if they can apply. But so at any rate, so those are just a couple of programs that we're just very, very proud of within the College of Nursing. And so I thought I would just open it up for questions and answer any questions that you might have, or comments, or anything that you might like to discuss.
Yes, feel free to, yep, feel free to raise your hand in the chat, and also just share any questions that you might have. Well, yeah,
Sal
I know I
Ross.
received some questions as well.
Okay.
There's some parents that were unable to attend. Well, there is one in the chat here. We can, do students apply for the honors experience?
So yes, so students, there will be a call for the applications before they go into that final semester. So if you have a student who is a current junior, that he or she should be looking for those applications in the fall of their senior year.
I see there's a raised hand. Sal, if you would like to unmute yourself and ask Dr. Foley your question. Sal, are you there? No? Okay. And I see there's another question in the chat. This is from Arlene McHugh. Please explain what happened to the white coat ceremony this year.
Oh, so we were, we had planned to have the white coat ceremony this year. And actually we did have the white coat ceremony, but it was on campus. And we also had a remote, there was a remote option as well. Last year, we were not able to have the white coat ceremony at all because we typically have it in January, and that's when the state was shut down. So so this year we did have it, and there was a remote option, and there were some students in the auditorium as well. Our white coat ceremony is typically, so just for anyone who might not know what that is, it's a ceremony where students actually receive their white coats, so their lab coats. And it's a ceremony. We have our priest who is on the IHS campus, and he's there, and he does a blessing of the hands. It's a lovely ceremony. And then the students have their white coats. And so we usually do that in January or February because it's when our students actually begin their nursing sequence. Because we are on this other campus, our students take their first 3 semesters of courses on the South Orange campus. So they take most of their support courses, their anatomy and physiology, their chemistry and microbiology. There is one nursing course that is offered in their first semester sophomore year, but it's offered on the South Orange campus, and our faculty go to South Orange and teach that there. And then the second semester of sophomore year is really when our students enter the nursing sequence. And there are 2 lab courses and then other didactic nursing courses offered that semester. And that's when they start having classes on the IHS campus. We tried to keep the curriculum so that students aren't in the same day driving back and forth from Nutley to South Orange. And so it's a little bit easier for our students. Many of our students, well, not many, but some of our students still live on the South Orange campus, their juniors and senior years. But many of them also look for housing closer to Nutley and Clifton. But at any rate, so that's why we offer the white coat. It's sort of an entry into the nursing profession. We do it in the spring semester, January, February, because that's when they're actually starting their nursing courses. The white coat ceremony is something that was actually done many, many years ago in the early 1900s in medicine. And the reason that physicians started wearing white coats was because there was no real formal medical education at that time. And so so you could become a doctor just through an apprenticeship. And so physicians who actually graduated from medical school wanted to separate themselves from others who didn't. And so that's when they started wearing the white coat. The first white coat ceremony, actually, formal ceremony, took place at Columbia University. And Arnold P. Gold was a pediatrician, and he started that ceremony. And again, it's to show not only that healthcare providers, physicians, nurses, and now, physical therapists and other healthcare providers also celebrate white coat ceremonies. But it's to show not only that they're competent and educated, but also warm and caring. So, yeah.
Thank you, Dr. Foley. Thank you, Arlene, for the question. There is another question from Pam. Are clinicals assigned to or chosen by the student?
Oh, so students register for their clinical section, but and sometimes they can sort of figure out based on who's teaching the course where it will be, but no, they don't register for a specific clinical area. We want to make sure that our students, we offer clinical experiences in over 60 healthcare institutions throughout the state. And with the exception of very far South Jersey down by Camden and Trenton. But, and so, yeah, students are assigned the clinical, but it's based on the section of the clinical that they're in. And we also want to make sure that they have a well-rounded experience. We don't want them all at the same hospitals, at a community hospital or a city hospital. We want to make sure that they get a well-rounded experience.
I also received this question. It's a big one too. What has been your biggest challenge and also most rewarding part of your position as Dean of the College of Nursing?
So I guess I would have to say that my largest challenge as dean truly was managing through this pandemic. That, the uncertainty, the need to make sure that our students received the same quality education and the ability to become professional nurses, that was probably the largest challenge that I had to deal with. Likewise, probably many of you who are working as you know, when now that we're so used to doing everything virtually, and we have many meetings because of the technology, it's easier to meet with different people, and who might not be in the same building or even on the same campus. But what that has done, it has increased the number of meetings that we have to attend. And there seems to be not as much respect for others' time. So especially in the heat of the pandemic, when it had first started, we had meetings that went from 8 o'clock in the morning literally until 9 o'clock at night. And that has settled down somewhat, but it was just because of the fact that we needed to make sure that everything went well. And like I said, then we had to actually, the College of Nursing, so I was the first dean in the state to actually submit a letter to the Office of the Secretary of Higher Ed. And the deans of higher ed in New Jersey, we meet. Well, then we were meeting almost weekly, but we meet typically 3 times a semester, and we were meeting more frequently. And so not only was I making sure that our students had the opportunities, but then I was sharing with them what they needed to do, and to make sure that the rest of the state was graduating nurses. So at any rate, that was probably the most challenging thing I had to deal with as dean. The most pleasurable is when I'm actually with our students and interacting with them and seeing them graduate, and hear them when they come back after their alum, and knowing the wonderful things that they're doing. So just recently, just to give you an example, our leadership students met with the president of Atlantic Health at Morristown Medical Center. Her name is Trish O'Keefe, and she's one of our alum. She is one of our PhD alum. And so at any rate, I had the pleasure, I was invited to go with our senior students, and Trish spoke to them about her leadership journey, and, where she went and how she got there. And so afterwards, after Trish left, and I was there with the students, their clinical faculty member, and Dr. Connolly as well. And we were talking, and the students were asking questions. And afterwards, after they left, Dr. Connolly actually said to me, "Marie, we can tell that this is what you love the most." And it is. It's what I'm a educator, and being with the students truly is the most rewarding to me, and just being with them and watching how they've grown and so on and so forth. So sorry, I tend to go on, but
Yeah, that's wonderful. Thank you, Dr. Foley. There's another question in the chat from John and Janine Daly. When must the students have CPR certification?
Oh, okay. So they have to have their CPR certification, but I don't know if it's actually before they go into. I think it's probably during the second semester of sophomore year when they're in the labs. So, but our faculty will let them know. There's a very intensive clinical requirements that are required for our students. And because every agency might require something a little different, we have taken all of them and put them together. So and our assistant dean for student success and the faculty members and the chairs talk to the students and tell them what they need in order to be approved to go to clinical at any agency in the state. So I'm not sure if the CPR is, they get it during that semester, or they have to just have it before their junior year. The junior year, their first semester, is when they actually go out into those clinical agencies.
Thank you, Dr. Foley. I see Sal has raised his hand again. Sal, if you want to unmute yourself.
Sorry, last time when I went to unmute it, I hung up, so I
Ah,
All
apologize.
right.
no
But
problem.
We're glad
my
you're back
daughter's
on.
my daughter's a freshman, and she was signing up for her sophomore classes, some of the core classes, and they were full. She was in the last group to register. So she's been getting, I guess she got two more of them. She's still missing one. Now, does that happen often? And what do you do if she can't get the core classes? And does that follow her when you go into junior and senior year?
So your daughter should have a freshman advisor. So she needs to talk to the freshman advisor, but she should also contact Dr. Elizabeth McDermott. Here, I could put her name in the chat. She's our assistant dean for student success, and she actually oversees our academic advisors, and she will be able to, so could she not get into chemistry or micro or something like
I think it
that?
was micro.
Okay.
She got into
So,
the lab, but not in the class.
so she's in the lab, but not the class?
Right, which makes no sense to me either.
Yeah, that doesn't make sense to me either.
So-
But that doesn't mean, I'm not the one that's like in there with the
Right.
registration. But so I would have her here, let me write it in the chat. So I would have her, she probably knows Dr. Elizabeth McDermott.
I
So,
put her
Because she
contact
did call-
information, Dr. Foley.
She did
Oh,
speak
okay.
to her advisor, and
so
they
she's,
said just keep going back and waiting for something to open up.
so that's what her freshman advisor told her?
I'm pretty sure.
Okay, but I would just have her talk to Dr. McDermott anyway.
Okay.
Yeah, just tell her to email her and because also Dean McDermott would need to know, because then she'll go to chemistry, or no, it was micro, you said, right? So she'll go
Yes.
to the biology department and say, we really need another section. We have so many students who are telling me they can't register. And so yeah.
Okay, I'll have her to contact.
Okay, great.
Thank you very much.
You're
Thank you,
welcome.
Sam. And I also shared her Dr. McDermott's contact.
Oh, okay,
information.
perfect. Thank you.
Perfect. You're welcome. There's a couple of questions in the chat. And there's another question from Arlene. The clinical clearance process appears daunting. Please address the process the student must embark on this summer.
Okay, so I am really not the person to answer that question. The clinical clearance is within the undergraduate student handbook. And so first of all, is your student a sophomore going into her junior year or his junior year?
Yes, this is her second semester sophomore year.
Okay, so so she should do the same thing, go and talk to her nursing advisor if she's really overwhelmed. But the process should be outlined in the undergraduate student handbook, which is on Blackboard. There's an undergraduate, Blackboard is the learning system that our students use. And the undergraduate student handbook is in the undergraduate Blackboard system. And that's also outlined there.
Okay, thank you.
You're welcome.
Thank you, Arlene. And I see there's another raised hand. Joe Solder, if you want to unmute yourself and ask away.
Dean, first off, you are doing a phenomenal job.
Well,
As
thank
an
you.
alumni of the Seton Hall program in 19 something, we'll just leave it at that. The college did prepare me well. I have had many years in nursing and is now in a leadership position. And I attribute my success to everything that I had learned at Seton Hall.
Thank
So,
you.
having a daughter carry the legacy on is unbelievably flattering. It just blows my mind every day. But the question I have to ask, Dean, is there was some rumors going around that they were looking to move out of Seton Hall with the College of Nursing. Where is that, and what truth is it? I know there is a lot of rumors going around, and everybody has an opinion. What is the intent of Seton Hall and the program status of where we are?
So, so the provost and some of the other faculty and a strategic planning group met. And what you're referring to is what was titled Seeds of Innovation. And so our provost, working with these groups of faculty, came up with a plan and one of those plans was to help decrease some of the administrative loads within the university. So some of those things were, number one, to combine the School of Education with the School of Communication and the Arts. And the second was to combine the College of Nursing with the School of Health and Medical Sciences. And so there are individuals who are working on those working groups. And currently, the School of Communication and the Arts and the School of Education are the two deans and then some of their faculty. And literally, they meet weekly and sometimes bi-weekly to look at synergies and combined programs that they might be able to offer and things like that. The goal is really to decrease the number of administrators and to spend more money on students and on the educational piece. So that those two schools are currently working together. The College of Nursing and the School of Health and Medical Sciences are not slotted to even begin conversations until August of 2023. So currently, we continue to function separately as we do. We're both, so the School of Health and Medical Sciences and the College of Nursing and the Hackensack Meridian School of Medicine are all co-located on the IHS campus in Nutley. So there's the three deans and, the three schools and so on and so forth. The goal of those that building, we'll say, is to focus on interprofessional education. And so pre-pandemic, we did more than during the pandemic, but we're starting to get back to it again. So pre-pandemic, our undergraduate students in nursing and the medical students did some simulation experiences together. And that was a wonderful experience. And as you yourself know, that most medical errors are made because of lack of communication. And so that provides our students with the ability to speak with other healthcare providers and practice those kinds of skills. Some of the other things that we did with the three schools were also there were seminars that the School of Health and Medical Sciences, because the School of Health and Medical Sciences already is interprofessional in that it offers programs in physical therapy, occupational therapy, physician's assistants, speech therapy. So those students all work together. So those were actually great programs too. I attended a few of them with our students, both undergrads and grads. And, they gave a case study and students worked in teams on interprofessional teams and came up with a plan and things like that. So we're already, in the same building. We certainly are still three separate schools. We really have no affiliation with the Hackensack Meridian School of Medicine, other than it's a great opportunity for our students to do these kinds of experiences with medical students. But Hackensack Meridian is not part of Seton Hall University anymore. So there is discussions of combining those two schools, excuse me, nursing and SHIMS, but part of the reason that our schools were put off is for, until after Com Arts and education. School of Health and Medical Sciences was actually originally developed as a school of graduate medical education, which was to provide continuing education for physicians. And then as the years went on, it grew into the School of Health and Medical Sciences. But because of that, they have their own, what we call, faculty guide. So, and the College of Nursing belongs to the Seton Hall faculty guide. And the faculty guide is, I guess if you were a union, it would be considered your contract. But the faculty guide talks about types of positions, and it's basically everything that governs faculty. And so because SHIMS has its own faculty guide, and it's very different than the South Orange faculty guide, there's a lot of work that has to be done before those schools can combine in relation to those kinds of contractual policies. So, yeah. Does that answer your question?
No, yes, I was just concerned with if you do move to that, how the Board of Nursing or the American Nurses Association looks at that for credentialing, because now taking Seton Hall, a nursing program that has been in place for a significant amount of years with a phenomenal success rate for passing the boards, now is going to be looked at as a brand new program. And does that affect how they're going to lay out courses? Because I know that they play a big role when a new nursing program comes out. I was able to see with my experience what William Patterson, when they first came online, when Montclair came online with their first program, and if I'm not mistaken, they're graduating their first full 4-year program this year,
Right.
which is being scrutinized under every step of the way. And is Seton Hall willing to jeopardize many years of great success and positivity to restart this all over again? That's
So,
my big concern, Dean.
right. No, and I understand what you're saying, but no, the College of Nursing, as you said, first of all, it's the oldest bachelor's program in the state. It was started in 1937. And our programs are completely accredited. That will not change. The dean, if the dean isn't a nurse, the dean of the entire school isn't a nurse, the chief academic officer, meaning perhaps an associate dean, it depends on the level, that individual would have to be a nurse. And because we have a PhD program, it would have to be a PhD prepared nurse. So it doesn't affect our programs per se. It certainly doesn't affect anything within the State Board of Nursing. The State Board really basically is concerned with licensing, with the NCLEX exam. And so none of that will change. There's many schools who have, who are, schools of nursing and health sciences or health studies or whatever their titles are. And so it honestly, it does not affect the credentialing. What it might affect, to be completely honest, is grant funding. So, and the College of Nursing has actually been very fortunate within the past couple of years. We've had 2 SAMHSA grants for, those are interprofessional grants though, but those are for the College of Nursing wrote and received them. We have almost $1 million in funding for those 2 grants, and it's to train nurse practitioners, physicians, and physicians' assistants to provide medication assisted treatment for individuals with opioid use disorder. We also have funding, from the Robert Wood Johnson Foundation. We have funding from the Healthcare Foundation of New Jersey. So most of our grants, with the exception of the SAMHSA grant, which is a federal grant, most of our grants are foundation grants. I don't think that will be affected that much. What you do see sometimes is the federal funding. So, certainly the schools throughout the country who receive the most federal funding are colleges or schools of nursing. So they're standalone schools. That doesn't mean some of the others haven't gotten funding. But and we don't even know, because I have to be honest, there are so many schools today that that are doing that. Monmouth University has a PA, they started as a school of nursing, and they have, I think, a PA and maybe OT and PT. Fairfield University. The difference is those started as schools of nursing, and then that administration, probably with some prodding from the central administration, open some of those other programs, where ours is going to be a little bit different, because these are two functioning schools that that will then combine into one. So I certainly hear your concerns. It and it all depends on who the administration is, depending on what the student outcomes are like. So, and when I say administration, I mean like the deans and associate deans of the schools themselves. So it really should not affect the students in any way, but it might affect some of the funding that the school receives. So, but we'll see.
And Dr. Foley, I shared the link of the summary of the strategic plan,
Okay.
where it gives a little more detail in regards to the reorganization of the academic units. So if anyone has more questions, feel free to look at that link. It kind of gives you an overview of what Dr. Foley was just sharing in regards to the reorganization of the different schools and colleges. But again, I know we're pressed for time. We're at 7:18, and I just want to thank Dr. Foley for sharing some wonderful updates and answering some of our questions from our parents. And parents, thank you for joining this virtual meeting with Dr. Foley. Dr. Foley, I don't know if you have some final comments or anything that you would like to share with our parents before we sign off.
So I just want to say thank you, number one, to you, Sandro. It's always a pleasure to work with you.
Same
And
here.
I really want to thank the parents. I have to tell you, you've done a great job. So I really enjoy your students. And truly, if you have questions, feel free to email me as well. So.
Well, thank you all. If you have any more questions, feel free to either send it to me or to Dr. Foley. But we really appreciate this interaction, and we want to continue the conversation. As we say, we're all part of the Seton Hall family, so we really want you to be a part of the process, a part of the community. And again, thank you for joining this virtual meeting with Dr. Foley, and everyone have a good evening, and go Pirates. Take care, everyone.
Thank you.
Thank you, Dr.
Bye-bye.
Foley. Have a good night. Take care, everyone.